Hi, my name is Norilyn and I'm a registered nurse. Today I want to talk to you about the question that nurses ask a patient during admission. Patients, I'm referring to an adult patient, so meaning 18 and above. Um, okay, I actually have a cheat sheet so that I don't forget anything. And if I do forget anything, please feel free to comment down below and write down the stuff that I forgot to ask the patient. Okay, because it's pandemic, because of the COVID-19 that's going on around the world, one of the questions that we ask is, have you been out of the country recently? Have you been traveling? And the name of the country, of course. And then we ask a bunch of questions regarding signs and symptoms that the patient might have. For example, shortness of breath. Are you having shortness of breath? Fever, coughing, loss of appetite, loss of sense of smell, loss of sense of taste, sweating. Are you losing weight without meaning to? Are you having diarrhea? You having nausea and vomiting? Things like that. Other questions are that we ask a patient during admission are, do you have any allergy? And the reaction that they get when they are exposed to this allergy or they ingest this allergy. We ask a patient during admission their actual height and their actual weight. But normally, we weigh the patient ourselves. We also ask the patient if they are taking any medications at home, and then we list them down. The medication's name, the dosage, and how they take them. And also, we ask a patient, who is your emergency contact person? The patient's relationship with that person, the phone number, and the address. We also ask a patient if they have an advance directive. Now, an advance directive, for those of you who do not know what it is basically a written statement that states or says the wishes of the patient if in any case that patient is unable to communicate with a doctor. There are two kinds of an advance directive. One is a living will, and the other is a power of attorney or a medical power of attorney. We also ask a patient during admission if the patient is a smoker, how much he smokes or she smokes, and how long, for how long. We also ask a patient if they drink alcohol and how much and for how long. Another question is vaccine. Have you been vaccinated with flu vaccine, pneumonia vaccine, and COVID vaccine? For the flu vaccine, though, we only ask this question during flu season, which is around September to April, I believe. We also ask our patient during admission the kind of diet that they have at home. Is it a regular diet? Basically, you pretty much eat anything you want, or is it a special diet? Like, are you a vegan, vegetarian? Are you on a consistent carbohydrate diet? Things like that. We also ask our patient during admission how they do with their activities of daily living. From the word itself, it's basically how they manage at home. Can they cook their own food, eat without any problem, take a shower, take a bath, and if they are able to put on clothes without any problem, things like that. We also ask our patient if there is any thoughts of suicide or if they've any history of trying to take their own life. We also ask the patient if they've been if there is any history of abuse. Are they abusing drugs, alcohol, things like that? Or are they being abused, like physically, emotionally? So I think, yeah, those are the questions that we normally ask a patient during admission, an adult patient. Now, let's discuss the reason why we ask these questions to the patient during admission. For the COVID-19 questions, it's very important because the doctor can actually treat you quickly and properly right away. If he sees that, if he knows that you've been out of the country recently or you've been traveling in a place, even in your own country, wherein there's a lot of positive people in that area, and you are exhibiting or showing a lot of the signs and symptoms of COVID, he will be able to treat you right away with the proper drugs and proper treatment. For the nurses, if we know that you're being ruled out for COVID or you are positive for COVID, we are able to anticipate your needs. If you need a lot of oxygen support, we're going to make sure that there's oxygen in your room, nasal cannula is available, the mask is available, the number for the respiratory therapist is available so that we can contact the respiratory therapist right away if there's any problem. For the allergy or allergies that you might have and your reaction to it, um, we do not want to give you any medications that might give you an allergic reaction. But sometimes, some people think that they're allergic to some medication, but they're actually not. So I actually have seen this mostly um, when we get patients and we are ruling them for stroke, or they are actually admitted for stroke or CVA, or cerebrovascular accident, or TIA, transient ischemic stroke or mini stroke. Um, Now, there's actually two kinds of stroke, the non-bleeding stroke or non-hemorrhagic stroke, and bleeding stroke or hemorrhagic stroke. If you are um, under the non-hemorrhagic or non-bleeding stroke, normally the doctor will order an aspirin. And if the patient says, "Oh, I'm allergic to aspirin," the doctor will ask, "What happens when you take aspirin?" And if the answer is, "Oh, I get very, very upset stomach," or "I get very nauseous, I throw up," the doctor actually will not consider that as a true allergy. And the doctor will still give the aspirin to the patient. After explanation, the doctor will say, "Oh, that's not a real allergy. You can still take your aspirin." And the reason for this is because for a patient who really needs aspirin, like people who has CVA or stroke, non-bleeding stroke, we do not want their blood to clot or solidify. So we don't want it to become solid or a clot. Because if you have clot, if it goes to your brain, you will have a stroke. If it goes to your heart, you can have a heart attack. And if it goes to your lungs, you can have pulmonary embolism. And if it's in your leg, a DVT, of deep vein thrombosis. So there's a lot of things that can happen if you are prone to getting clots, blood clots in your blood. So that's the reason why when it comes to aspirin, and you say, or the patient say, "Oh, I'm allergic to aspirin," and the reaction is basically a gastrointestinal reaction like upset stomach, nausea, vomiting, the doctor will not consider that as a true allergy. So it's very important for us to know what kind of reaction you really have when you say, "Oh, I'm allergic to something." For the height and the weight, it's very important because just like the babies, the pediatric population, wherein the doctor needs the weight of the patient, of the babies, of the toddler, the kids, to order the proper dose of the patient. It's the same way with the geriatric or the older population. Um, Sometimes the doctor needs the actual weight of the patient to order the proper dosage of the medicine. So if a nurse, or if they didn't take the height and the weight of the patient, at times the pharmacist will actually call the nurse and say, "Hey, I need the actual height and the actual weight of the patient so that we can order this particular medication. Um, Normally, though, for the height, I mean, for the weight, we actually weigh the patient ourselves. So if the patient is able to stand up, we use the standing scale. For the for a patient who is unable to stand up, very very weak, and basically bedbound, we either use the bed scale of the bed if the bed has a bed scale. If there's no bed scale on the scale on the bed, um, what we do is use a Hoyer lift. I haven't seen a Hoyer lift for a long time because all of our beds has the ability to weigh the patient. But anyway, if you don't have a standing scale, you don't have a bed scale, and you don't have a Hoyer lift, I hope that you know the actual weight of your patient. Or if you're the patient yourself, you know your actual weight. For the medication prior to admission, it's very important also because some patients' medicine is very, very important for them to take like every day. Like, for example, Synthroid or levothyroxine for their thyroid. So, if you are one of those patients wherein you have like five medications that you take at home, and if you know them by heart, you don't have any problem. You just tell us the medications and the dosage and how you take them. But if you are one of those people who actually cannot remember your exact medication, I suggest that you list them down and list down everything, the name, the dosage, and how you take them. Or actually, I've heard this from a friend of mine who is also a nurse, and she said there's some apps in our smartphone, and you can download them for free, and you can write down your medications that you take at home. So when you go in the hospital, you just use that. So no problem, right? But for some who do not want to do that, you can just list them down, put it in a piece of paper, and put it in your wallet so that when we ask you, you have a complete list of your medications. Um, in that note, I also want to say that not all the medications that you take at home will probably be ordered by the doctor. So, for example, you have five medications that you take at home. It doesn't mean that the doctor will reorder those five medications. Sometimes they do. It just depends on the health problem are that you have when you go to the hospital. But normally, the doctor will just order one or two medication out of the five. Um, just a side note though, if you think that you really, really need the medication and that you really need to take this medication every day, you have to insist to the doctor and to the nurse that you need that medication. So as a nurse, I will call the doctor and insist that, hey, the patient actually really need to take this medication, and you can tell me why, obviously, why you are insisting that you need to take this medication every day, or why that particular medication has to be reordered in the hospital. Okay, for the emergency contact person, it's very important for us to know your emergency contact person so that if anything happens to you, we can call them right away. Like, for example, if you get discharged in the hospital, we'll call your emergency contact person and we can say that, oh, by the way, we're just charging your patient this afternoon at 5 p.m. You can pick up your patient at this time and all that stuff. We can also discuss your discharge instruction with your emergency contact person. Also, sometimes things happen in the hospital. Sometimes the patient um, get worse and is unable to consent to some stuff, to a procedure, like a surgery or test. So in these cases, we need to contact your emergency contact person and actually ask for a consent, even on the phone. So um, it's very important for us to have a contact person. Another thing that we use an emergency contact person for is sometimes for very old people. Sometimes they get confused at night. Sometimes even not at night, during the day sometimes. Some patients are still very nice. We call them pleasantly confused. But some people, they get very combative, they get very aggressive. Sometimes they spit at you, they spit at us. Sometimes they bite, things like that. So, what we do, and this usually works, we call the emergency contact person, who usually is a family member or a friend or a spouse, and we let them talk to the patient. Hearing a familiar voice calms the patient, and the emergency contact person will be able to calm the patient down just by answering the question, just chatting about stuff, anything at all. So those are some of the reason why we need an emergency contact person. For the advance directive, this is basically, as I said, the wishes of a patient if such a time comes that he is unable to talk with the doctor. So if anything happens, like if the patient goes in a coma or things like that, um, we still know, or the doctor still knows what to do for the patient. Or if you do not have, that is under the living will. If you have a power of attorney or a medical power of attorney, we can call your power of attorney or the medical power of attorney and ask what you want us to do for the patient in cases wherein, the patient is unable to communicate with the healthcare workers, with the doctor or the nurses. Regarding smoking and drinking, obviously in the hospital, smoking is not allowed because it can cause fire, you can cause explosion because of all the oxygen in the hospital. So basically, if a patient smokes a lot and drinks a lot, we really do not want them to go in withdrawal because it's very, very painful for some people. Um, for some patients, they do not have any problem quitting cold turkey. They stop smoking, they stop drinking, and that's it. Nothing happens to them. But for most patients, it's very, very hard. And it's very hard for the body. It's actually sometimes very dangerous. So we do not want them to go into withdrawal. So if you're a smoker, the doctor can order a nicotine patch. Or if you're already on the floor and the doctor did not order that, the nurse can call the doctor and ask for a nicotine patch so you do not go into withdrawal. Um, Same thing with alcohol, with drinking alcohol. We can give medication to actually relax the patient so that the patient will not go into withdrawal because it's very painful and it's extremely dangerous at times because you can have a heart attack basically. Um, you can have like seizure if it's not managed. Okay. For vaccine, the flu vaccine, we also ask this question. Flu vaccine, pneumonia vaccine, and COVID vaccine. Um, for the flu vaccine during flu season, we ask the patient if they already have it, if they already had the vaccine. But if they didn't and they want us to give them the vaccine, we will do that. At times, though, some patient does not want to get the flu vaccine, even after explaining to them the importance of getting it. And we honor that. Patient has the right to refuse the treatment, so or medication or whatever that we want to do for them. Um, for the pneumonia, usually this is given to older patients, but it's also given to people, even young patients, or but still adults, because of their comorbidities, meaning they have other diseases that make them prone to getting sick a lot. The diet. We ask this question because we want to order the proper diet for you. If the doctor orders a regular diet, meaning you can pretty much eat anything you want, but you actually eat a special diet at home, we can order that for you. If you are a vegetarian or a vegan person, we can order that special diet for you in the hospital. That's why we ask this question. Um, for activities of daily living, basically, we want to make sure that you are able to take care of yourself at home. If you do not have any problem doing a simple task like cooking, eating, taking a shower, putting on your own clothes, things like that. If you have any problem doing the activities of daily living, we are able to order a physical therapist and occupational therapist to assess you and help you out during your stay in the hospital. For the suicide thoughts and inclination, if you are positive for like thinking of taking your own life, or a patient is thinking of taking their own lives, we normally ask for a psych consult. So a doctor will evaluate the patient if the patient is truly suicidal or not. Also, we will put the patient, we will order a sitter for the patient. A sitter is basically a person who sits with the patient and makes sure that the patient does not harm himself. But if the patient is positive, there will still be a sitter, even though that the sitter will stay outside the room. So obviously, the room will be closed, but we still can see the patient through a glass. Um, for abuse, so we are required to actually report abuse if a patient is being abused physically, and things like that at home. We are required to report this by law, and social worker will be involved and things like that. So that's the reason why we ask these questions to the patient during admission. Um, if you have any questions, if I forget something, please please write down in the comment section if I forget something else to ask the patient, or the family member that goes with them during admission. I think that's it. I hope you learned something. Thank you so much for watching. Take care. Be safe. Bye.